Hello, everyone. Today, my guest will be Dr. Padmavathi Roy. Um, Padmavathi, could you tell us a couple of words about yourself?
Yeah, thanks, Chris, for inviting me. I'm Dr. Padmavathi Roy from Global Architecture Office, and I am with DXC Legacy CSC for more than 15 years now. So currently, I am in the architecture office in Calkinson's team.
Oh, okay. When have you learned Wardley mapping?
Yeah, it's about 2 years back. One of my colleague in my team, Chris Rogers, had introduced me. In fact, he had actually given access to LEF learning module. Then I registered, and I was on and off in learning, but I started getting the interest to learn and then apply mapping wherever in my business scenarios. So then it was a kind of applying Wadley map everywhere and anywhere.
Oh, that's an awesome story. Could you tell us what is the value that you are getting out of the Wordley mapping? In other words, why are you using Wordley maps?
Yeah, so I can say the true value I could not get until last year, February, when the world is hit with the horrible pandemic and we were all watching news continuously, various channels and getting into data and everything. It got me think actually. So one weekend I literally sat complete 2 days, Saturday and Sunday. I sat and started putting this map, which I am going to share with you. In fact, previously I shared. So that map, I try to showcase how we would have contained the virus spread from Wuhan to other nations if we would have taken a proper steps. So that's what I wanted to show, and then I have put out the map, and it helped me immensely to understand various steps wherein we would have contained this virus effectively, but we failed to do. And that is the reason today we are a global death rate of 1.95 million and total cases 90 plus million globally. So I think Wadley mapping helped me to understand the depth of a current situation where we are in. It is providing the awareness of the situation and also providing awareness or knowledge for future, how we can actually apply various methods in containing the virus for this scenario. It so then after February, when I done this, I shared this mapping with my colleague mm, uh, Stevens, Dave Stevens, and then he immediately told, "Okay, now your blog post is ready." That was wonderful, and then I shared it with my manager Colkinson, and he also encouraged me a lot. In fact, he shared this with Simon Wadley and LEF team as well the same day. And then I started putting that blog post, and then I shared with the open group, and then open group published this blog post in May or so, April or May. Yeah, in healthcare open group, this blog was published in as well in May 2020.
That's an awesome story. Could you show us the map? Because I'm very curious to see how it looks like. I mean, I know I
Yeah,
have seen it in the past, but I think our viewers will be very interested to see what's on this map.
yeah. Let me just share my complete screen. Yeah. So this is the map. Uh, hope you are able to see, right?
Yep.
So uh, as I mentioned, what happened is in one of the primary health center in Wuhan, patients started coming with flu-like symptoms, right? So they have flu, but the symptoms of flu are different from regular flu, right? They are deviation in the normal flu symptoms, and they started reporting new symptoms as well by groups of people in region that Wuhan. And also the Wuhan doctor, the initial doctor, identified that these persons who are having comorbidities like diabetes or hypertension, their situations are very quickly turning very fatal with this new flu-like symptoms. That's when the physician thought, okay, this definitely not a regular flu. It may be uh, maybe SARS kind of COVID virus, right? Then he had actually tried to alert the authorities, right? Then as a result of that, now we are seeing after February 2019, what had 2020, what had happened, right? At the end of the 2019 and beginning of the 2020, we had seen a major catastrophe across the world, right? And then this was uncontained in the Wuhan. People started traveling. There was no airport screening, and there is no contact tracing. There is no other screenings at the airport. As a result of that, it had actually from the region 1, from the genesis in Wuhan, it had spread to um, one single region in China itself. And then because there are no contract tracing, there is no health authorities decision, and failure at every stage. You can see failure at the government level, failure at the health authorities level, failure at the world healthcare organization level, right? Then it started spreading. This epidemic had spread to other regions in China, in other new regions. Epidemic ENR is the epidemic in new other regions, right? And what would have done at this stage? We would have actually, the SARC nation and NATO, UN, EU would have actually met on an urgent basis to look into the evolving viral situation, and they would have locked their borders. That has not done, right? So because this virus is not contained in China, people started traveling because basically it affects the people, and then through the people it is getting transmitted to other people. So different people, the presumed infected people also, they started traveling, and and the infection spread to the people who are not exposed, and some of the people are quarantined, and actually it had spread from one region to multinational. It had gone as pandemic. Here you can see it is still in epidemic stage and spreading to other regions of the same country in epidemic, and then it completely blown into multiple countries. So then it had turned as pandemic. So you can see from genesis to complete blown pandemic in the evolution phase. And what would have done differently, right? So when the initial alert had happened here through this physician, when the person, a group of people started reporting, these region would have been locked for external exposure. People would have been contained. That has not happened. And then also the region, the other countries also, they would have closed their borders, right? And also maybe studies on the virus had started, but um, when a country is allowing people without a screening, without a testing, without contact tracing, WHO or the health authorities and government authorities across the world would have penalized a country where a new virus is originating, and they would have not following the containing measures, right? So how it could have been prevented, that connected healthcare system, this is another great problem that the world is facing today, that also would have played a major role. So through this map, actually, I try to put that context of person to nations, evolution of the virus, and then how would have contained if we had a connected. If let me show you in this another picture, right? So when a person alerts healthcare system with a new kind of symptoms, um, and then WHO is identified, okay, such and such kind of virus is becoming epidemic and it could become pandemic in multiple regions. So all the healthcare workforces across the world would have been and all these different healthcare systems here we are seeing are actually bombarded with the flu with pneumonia kind of flu, which is turning very quickly into pneumonia. um, would have actually, if there had been a connected healthcare system and flow of information, boundaryless healthcare flow information is being there, then this catastrophe would have been prevented, right? So then World Healthcare Organization would have conducted an urgent meeting with all the nation healthcare leads or government health authorities, and then they would have taken these measures like airport screening, isolation of the infected patients, and starting the contact tracing at multiple points, and immediately putting the lockdown of all airport, ship ports, international borders, and national borders. If they would have been a connected care boundaryless flow of information across, so now we are actually completely technological advancements are happening, there are so much of research, but if there is no connected system and we are not able to use how um, we have various uh, methods, tools. For example, here we are talking about Wadley mapping. If there is a situation to understand to understand, gain more information about the awareness of what kind of situation we are in, where, what step, which thing would have been um, happened, and what can help us, who are the players, and what are all the different systems. If we would have that understanding, really that would have made some positive difference, but unfortunately we were not in such situation. But at least we need to take this learning and then try for a better world.
I do understand it, and it's awesome work. Could we get back to the slide or to the diagram in which you have presented this connected system? Because this one is really, really interesting. So it looks like there is this health information systems, OHIRA, which like integrate all the data from different governments or from different regions out there in the world. Do you think we will get such a system in the predictable future?
Yeah, this is a very good question. This is what we are actually trying from healthcare forum, from the open group, uh, and we are a kind of in the making of such a kind of connected healthcare system or the reference architecture for connected healthcare. But currently, we are also taken a little bit diversion in providing the mass vaccination reference architecture. So, uh, keeping the current situation into the priority.
Yes, yes, I understand it.
But
So
we will be working continuously on making such an effort where we are having, that is the vision actually, and we should definitely need to have, and all the countries need to support such kind of boundaryless flow of information between the borders, so that we can prevent such kind of major catastrophe. So a lot of economical damage had happened, lot of lives have gone, and lot of disturbance around the world, which has taught so many lessons to mankind. So we need to take these lessons positively and put that into the improvement backlog and work on those improvements.
I couldn't agree more with what you are saying. I mean, this is awesome, awesome work. Um, could you could you tell me what would be your piece of advice to people who are starting their adventure with worldly mapping?
Yeah, this is, I think, this is very dear to my heart, because not only this, uh, I started putting Wadley maps for every situation which I am in. in my customer like discussions everywhere. So to make everyone understand where are we currently with respect to our situation and what we maybe want to go further, and what are all the dependencies and what are all those um, different aspects that we need to keep in mind. So not only for me, for other stakeholders in the teams which I am working, this is been very, very, I can say, like, one can completely rely on this Wadley mapping and start using. So, um, as I mentioned to you, registered for the Wadley mapping course maybe 2 years back, but I myself identified the real value unless until I put that map into this DrawIO, and then got complete end-to-end information of what exactly where I am and what exactly a situation can go, how to turn a negative situation into positive situation. That kind of awareness and understanding I myself got. So anyone can get benefited from there, and it is not a rocket science. We just need to put our information into the proper perspective of this mapping, understand the technical, maybe the words like pioneer, settler, town planner, how actually we can put this map, like what is the genesis and how we can understand the progression.
Awesome. Thank you. It's an excellent piece of work, and I like this slide very, very much. I would like to thank you for finding time and for participating in this interview. Last second thoughts you would like to share about worldly mapping?
Yeah, so I highly recommend everyone to learn Wadley mapping, and not only learning, but they need to use Wadley mapping on a regular basis, with use them during discussions with the customers and with other stakeholders, to understand, to provide or to have that kind of situational awareness, and uh, get the positive results out of Wadley mapping. It helped me immensely. It can help everyone in the similar manner.
Thank you so much for those words. It was a real pleasure to have you here.
Thanks a lot, Chris, for inviting me and allowing me to talk on my experience.
Thanks.